Hey everybody, welcome to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about another antidepressant medication known as Sertraline. It has a brand name of Zoloft. Now before I start talking about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now I did mention that the major indication for Sertraline or Zoloft is major depressive disorder or MDD. However, there are some other indications where it could be used as well. It can be used prophylactically for recurrent MDD. It can be used to treat the depressed phase in bipolar, as long as there's a mood stabilizer on board with Sertraline. Sertraline may be used to treat bulimia nervosa. It can be used in OCD or obsessive compulsive disorder. It's been shown to be effective to treat panic disorder with or without agoraphobia. It can be used in PTSD or post-traumatic stress disorder, as well as premenstrual dysphoric disorder. Many people have had success treating generalized anxiety disorder with Zoloft, as well as treating premature ejaculation. Now, before somebody was to use Sertraline or Zoloft for the first time, there are some precautions or warnings that they should be made aware of. The first, and perhaps most crucial, is that selective serotonin reuptake inhibitors, such as Sertraline, are known to sometimes cause an increase in suicidal ideation, as well as hostility. This is more prevalent in younger individuals. However, all patients must be monitored while using these medications for a worsening of depression, as well as the appearance of that suicidal ideation. This would usually happen more often in the beginning of therapy. However, it can happen anytime throughout the course of therapy, especially during a change in dose, whether that be an increase or a decrease. When starting this medication, it may impair your physical or mental ability to perform hazardous tasks, such as driving an automobile or operating heavy machinery. It's a good idea to avoid doing these tasks until you really know how the medication makes you feel. Medications in this class may cause mania in about 20% of people with bipolar who use this medication. It's important to note as well that because Sertraline has an effect on serotonin, if it was to be used with other medications that affect serotonin levels as well, this could put a patient at an increased risk of experiencing serotonin syndrome. Sertraline is one of the 3 SSRIs that may affect other medications that are highly protein bound. Although Sertraline is not one of the primary SSRIs that does have an effect on the cytochrome P450 system, in doses over 100 milligrams, Sertraline does affect these enzymes. And the last precaution to note is just that we typically try to give the lowest possible dose to individuals who have hepatic or renal disease. Now, once somebody is made aware of the precautions and they start using Sertraline, more often than not, they'd be using it in capsule form. It's available as a 25, a 50, a 100, a 150, as well as 200 milligram capsule. There is also an oral solution which comes in at a strength of 20 milligrams per mil. In terms of the dosing for this medication, the cardinal rule is that patients would start off on a low dose and then increase that dose slowly over time with the guidance of their physician and pharmacist. By starting off on a low dose, it's thought that you can decrease your risk of having adverse reactions. The most important thing to be understood when initiating this kind of medication is that they do take some time to work. It can take anywhere from a couple weeks to a couple months to find that max benefit that you desire. Unfortunately, many patients, when first starting the medication, experience many side effects but not much benefit. A lot of these individuals would stop taking the medication. However, if you make patients aware of this situation, the likelihood of them continuing to take the medication long enough to get to that point where they can reach benefit is increased. One landmark trial, known as the STAR-D trial, showed that 30% of individuals using citalopram, an SSRI similar to Sertraline, reached remission after 10 weeks of therapy. It should also be noted that sometimes you do have to try several medications before you find the medication that works best for you. So don't give up if the first medication you try is not successful. Now, as with all medications, there are some side effects or adverse reactions that people may experience while using Sertraline, so I'll list some of those side effects here for you now. Drowsiness and sedation, as well as insomnia, happens over 10% of the time. Headache, as well as a feeling of excitement or hypomania, may happen 10% of the time as well. Disorientation or confusion happens in less than 2% of people. Some people may experience anticholinergic side effects. The most prominent of these would be dry mouth, coming in at 10%. Blurred vision, constipation, and sweating come in at 2%. Over 10% of people may experience some extrapyramidal side effects, such as a tremor. Over 10% of individuals may experience orthostatic hypotension, or a drop in blood pressure when going from a seated to a standing position. Over 2% of people may notice a rapid heart rate or palpitations, and less than 2% may experience changes on an ECG. Most common side effects with sertraline or Zoloft would be GI distress. This happens in 30% of people. And nearly as common, happening in about 30% of individuals as well, would be sexual side effects, which can present as either a decrease in desire or a decrease in performance. And lastly, just about 2% of people may notice a rash with sertraline. As well, same percentage, 2%, may notice a weight change of over 6 kilograms. That's all we're going to talk about today with sertraline or Zoloft. As always, I'm thankful you took the time to come by and watch one of my videos. If you found that the information was valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. Alright, take care.